Question 1. A patient with a persistent cough and weight loss arrives at the clinic. What is the nurse's priority action to prevent disease transmission? A. Administer prescribed antibiotics. B. Place the patient in a negative pressure room. C. Notify the public health department. D. Collect a sputum sample for culture. Answer: B. Place the patient in a negative pressure room. Rationale: the nurse's priority is to prevent airborne transmission of tuberculosis. Placing the patient in a negative pressure isolation room is the immediate action to protect others. While administering medication, A. Notifying authorities, C. And collecting sputum, D. are important. They follow isolation. Safety and infection control take precedence in clinical judgment. Question 2. A patient diagnosed with active TB is refusing to wear a mask during transport. What is the nurse's best response? A. Notify the provider immediately. B. Educate the patient about transmission risk. C. Cancel the transport order. D. Apply restraints to enforce mask use. Answer: B. Educate the patient about transmission risk. Rationale: patient education promotes cooperation and autonomy. While notifying the provider, A. may follow if refusal persists. Immediate patient-centered education is best. Canceling transport, C, or restraints, D, are not first-line ethical responses. Question 3. A nurse is reviewing TB medication adherence with a patient who expresses concern about side effects. What is the priority nursing action? A. Discontinue the medications immediately. B. Explain that side effects are rare. C. Assess specific concerns and discuss solutions. D. Refer the patient to a psychiatrist. Answer: C. Assess specific concerns and discuss solutions. Rationale: patient-centered care begins with assessment. The nurse must explore specific concerns to develop an effective plan. Discontinuing therapy, A, is unsafe, and minimizing concerns, B, is dismissive. Psychiatric referral, D, may be unnecessary. Question 4. A nurse is caring for 4 patients. Which patient requires airborne precautions? A. A patient with bacterial pneumonia. B. A patient with suspected active TB. C. A patient with influenza. D. A patient with cystic fibrosis. Answer: B. A patient with suspected active TB. Rationale: active TB requires airborne precautions due to its transmission via droplet nuclei. Influenza and pneumonia need droplet precautions. Cystic fibrosis requires contact precautions. Question 5. Which action demonstrates appropriate delegation regarding TB precautions? A. Asking an LPN to teach TB medication side effects. B. Assigning a UAP to suction a TB patient's airway. C. Instructing a UAP to stock N95 masks outside the isolation room. D. Delegating the collection of a sputum sample to a UAP. Answer: C. Instructing a UAP to stock N95 masks outside the isolation room. Rationale: UAPs can perform non-invasive, routine tasks such as stocking supplies. Teaching, A, and suctioning, B, require licensed personnel. Sputum collection, D, also requires a nurse or trained technician. Question 6. A patient asks why they must continue TB treatment after feeling better. What is the best response? A. You must finish it to keep your insurance coverage. B. Stopping now can lead to resistance and relapse. C. The doctor requires full treatment completion. D. TB can return in a few months regardless. Answer: B. Stopping now can lead to resistance and relapse. Rationale: explaining the consequence of incomplete therapy, resistance and relapse, addresses patient understanding and safety. Other responses lack therapeutic communication or accuracy. Question 7. What clinical judgment is most important before initiating TB medications? A. Verify TB contact tracing is completed. B. Check liver function test results. C. Confirm patient's employment status. D. Ensure the patient has a support system. Answer. B. Check liver function test results. Rationale. TB medications, such as isoniazid and rifampin, can cause hepatotoxicity. Liver function must be assessed before starting therapy. Social and contact concerns, A, C, D, are secondary. Question 8. Which finding requires the nurse to notify the provider immediately during TB treatment? A. Mild nausea. B. Reddish-orange urine. C. Yellowing of the eyes. D. Weight gain. Answer. C. Yellowing of the eyes. Rationale. Jaundice indicates potential liver damage, a serious side effect of TB medication. Reddish urine is expected with rifampin. Mild nausea and weight changes are not urgent. Question 9. A nurse notices that a patient on TB treatment has missed 2 directly observed therapy (DOT) visits. What is the priority action? A. Report to infection control. B. Re-educate the patient about adherence. C. Notify public health authorities. D. Document non-adherence and continue. Answer. C. Notify public health authorities. Rationale. TB is a reportable disease. Missed DOT increases transmission risk. Public health departments must intervene to support adherence. Education, B, may follow, but reporting is the priority. Question 10. A TB patient's family asks if they also need to be tested. What is the nurse's best response? A. Only if they show symptoms. B. Yes, close contacts must be screened. C. Testing is optional. D. Wait until the patient finishes treatment. Answer. B. Yes, close contacts must be screened. Rationale. Close contacts must be screened to detect latent or active infection. Testing is not optional or delayed. Symptom presence is not the only indication. Question 11. What is the nurse's role in ensuring patient safety during TB isolation? A. Assigning patients with TB to shared rooms. B. Using a standard surgical mask. C. Educating visitors on N95 mask use. D. Avoiding contact until the patient tests negative. Answer. C. Educating visitors on N95 mask use. Rationale. Ensuring correct PPE use is a core nursing responsibility. Patients with TB should not be in shared rooms, A, and surgical masks, B, don't offer adequate protection. Nurses should not avoid necessary contact, D. Question 12. Which priority assessment is needed for a patient newly prescribed isoniazid? A. Reflexes. B. Visual acuity. C. Liver enzymes. D. Heart rate. Answer. C. Liver enzymes. Rationale. Isoniazid can cause hepatotoxicity, requiring baseline and ongoing liver monitoring. Reflexes and heart rate are less directly impacted. Vision is more relevant for ethambutol. Question 13. A nurse finds that a patient with TB is not wearing a mask in the hallway. What is the immediate nursing action? A. Instruct the patient to return to the room and wear a mask. B. Call hospital security. C. Document the violation. D. Provide education during discharge. Answer. A. Instruct the patient to return to the room and wear a mask. Rationale. Immediate correction protects others from exposure. Documentation, C, and education, D, follow. Security, B, is unnecessary unless there's danger. Question 14. During patient teaching, which statement indicates understanding of TB transmission? A. I can't spread TB after 3 days of antibiotics. B. TB spreads through contaminated food. C. I need to cover my mouth when I cough. D. Wearing gloves will stop TB spread. Answer. C. I need to cover my mouth when I cough. Rationale. TB is airborne and spread via respiratory droplets. Hand hygiene helps, but gloves are not sufficient. Antibiotics take weeks to reduce infectivity. Food is not a transmission source. Question 15. What is the most appropriate nursing diagnosis for a patient in TB isolation expressing sadness and loneliness? A. Risk for infection. B. Impaired social interaction. C. Ineffective airway clearance. D. Deficient fluid volume. Answer: B. Impaired social interaction. Rationale: TB isolation can lead to emotional and social consequences. Addressing psychosocial needs is key. Other options do not align with the emotional response described. Question 16. Which strategy best supports medication adherence in TB treatment? A. Allowing self-monitoring of doses. B. Educating on long-term consequences of TB. C. Providing directly observed therapy DOT. D. Encouraging shorter treatment duration. Answer: C. Providing directly observed therapy DOT. Rationale: DOT ensures medication adherence and reduces drug resistance. Self-monitoring is unreliable. Education supports adherence, but isn't as effective as DOT. Shorter durations are often inappropriate. Question 17. Which patient statement requires further teaching about TB precautions? A. I'll need to isolate myself from family for a while. B. I can't go to public places while contagious. C. I can stop my medications when I feel better. D. I should wear a mask if I leave my room. Answer: C. I can stop my medications when I feel better. Rationale: TB treatment must be completed fully to prevent resistance. Stopping early is unsafe. Other statements are correct and reflect understanding. Question 18. What is the nurse's role in ethical management of a non-compliant TB patient? A. Punishing the patient. B. Ignoring refusal of treatment. C. Ensuring public safety and patient education. D. Discharging the patient immediately. Answer: C. Ensuring public safety and patient education. Rationale: nurses must balance individual rights with public health through education, reporting, and collaboration. Punishment, discharge, or ignoring the situation is unethical. Question 19. A TB patient's roommate is worried about infection. What should the nurse do first? A. Report the roommate's concern to infection control. B. Move the TB patient to another room. C. Educate the roommate about transmission and precautions. D. Ask the roommate to leave. Answer: C. Educate the roommate about transmission and precautions. Rationale: addressing concerns through education is the nurse's first role. Escalation A, relocation B, or eviction D are not initial appropriate responses. Question 20. A nurse is preparing to discharge a TB patient. What is the most important step to ensure continuity of care? A. Provide a list of community pharmacies. B. Schedule a follow-up with a pulmonologist. C. Notify the public health department for follow-up. D. Recommend rest and hydration. Answer: C. Notify the public health department for follow-up. Rationale: public health departments ensure treatment adherence and contact tracing. While other steps help, they don't ensure follow-up adherence and disease control. Question 21. A patient newly diagnosed with active tuberculosis is confused about airborne precautions. What is the nurse's best initial response? A. These precautions protect you from other infections. B. You need to remain in isolation to protect others. C. You must wear gloves to avoid contaminating surfaces. D. You will only need isolation during medication administration. Answer: B. You need to remain in isolation to protect others. Rationale: the nurse must prioritize education about TB transmission. TB is spread via airborne particles. Isolation protects others. A is incorrect as airborne precautions are not for the patient's protection. C and D show misunderstanding of TB infection control. Question 22. The nurse is caring for 4 clients. Which client should be assessed first? A. A client with TB who is febrile and coughing. B. A client with TB receiving a 4th dose of medication. C. A client with latent TB asking about treatment. D. A client scheduled for discharge with stable vitals. Answer. A. A client with TB who is febrile and coughing. Rationale. The febrile, coughing client poses the highest transmission risk and may be unstable. Clinical judgment requires prioritizing those with urgent or deteriorating conditions. Other clients are stable or require routine care. Question 23. A TB patient refuses to wear a mask while being transported. What is the nurse's immediate action? A. Cancel the transport. B. Notify infection control. C. Educate the patient on risks of exposure. D. Apply a surgical mask on the patient and continue transport. Answer. D. Apply a surgical mask on the patient and continue transport. Rationale. The surgical mask reduces TB droplet dispersion. Patient safety and public health are top priorities. Education C. is important but not immediate. A delays care. B is secondary. Question 24. Which of the following tasks can the RN safely delegate to the UAP caring for a TB patient? A. Administering oral TB medications. B. Educating the patient on airborne precautions. C. Assisting the patient with meals. D. Monitoring for side effects of TB treatment. Answer. C. Assisting the patient with meals. Rationale. UAPs may assist with ADLs like feeding. Education and medication administration are nursing responsibilities. Monitoring for side effects requires assessment and judgment. Question 25. A nurse is evaluating a patient with TB who reports yellow vision and nausea. What is the nurse's priority action? A. Reassure that side effects are normal. B. Withhold medication and notify the provider. C. Encourage hydration to reduce side effects. D. Document findings and reassess in an hour. Answer. B. Withhold medication and notify the provider. Rationale. Yellow vision may indicate isoniazid or ethambutol toxicity. Prompt action prevents further damage. Reassurance A. Delays treatment. C and D are inappropriate for a potentially serious adverse reaction. Question 26. A TB patient is on directly observed therapy DOT. What is the nurse's primary responsibility? A. Dispense medication for the week. B. Educate about drug resistance. C. Document side effects. D. Watch the patient swallow each dose. Answer. D. Watch the patient swallow each dose. Rationale. DOT ensures adherence by supervising each dose. It's the gold standard for TB management. A does not verify compliance. Education and documentation are important, but secondary in DOT. Question 27. A nurse enters the room of a TB patient and realizes she forgot her N95 mask. What is the appropriate response? A. Stay and limit contact. B. Cover mouth with a towel and continue care. C. Leave immediately and retrieve an N95 mask. D. Ask the patient to wear a mask instead. Answer. C. Leave immediately and retrieve an N95 mask. Rationale. Protection with proper PPE is essential before entering a TB isolation room. Staying unprotected increases infection risk. Other choices do not meet airborne precautions. Question 28. Which finding requires immediate follow-up in a patient receiving TB medications? A. Red-orange urine. B. Loss of appetite. C. Yellowing of the skin. D. Mild fatigue. Answer. C. Yellowing of the skin. Rationale. Jaundice suggests hepatotoxicity from TB drugs like isoniazid or rifampin. It's a serious adverse effect requiring prompt action. Red-orange urine is expected with rifampin. Question 29. A patient asks why 3 medications are prescribed for TB. What is the nurse's best explanation? A. We want to shorten your treatment duration. B. One drug would be too expensive. C. Multiple drugs prevent resistance. D. It helps reduce side effects. Answer: C. Multiple drugs prevent resistance. Rationale: using multiple TB drugs prevents Mycobacterium tuberculosis from developing resistance. This is a key principle of TB treatment. A, B, and D are inaccurate. Question 30. Which client requires airborne precautions? A. A child with chickenpox. B. An adult with pneumonia. C. A teen with pertussis. D. An elderly patient with COPD. Answer: A. A child with chickenpox. Rationale: chickenpox and TB both require airborne precautions. Pneumonia and pertussis require droplet, and COPD is not infectious. Understanding of transmission-based precautions is key. Question 31. A patient with TB asks when they can return to work. Which response by the nurse is most appropriate? A. After 2 weeks of rest at home. B. Once you complete all 6 months of treatment. C. When you no longer have symptoms. D. When you have 3 negative sputum cultures. Answer: D. When you have 3 negative sputum cultures. Rationale: returning to work is allowed after the patient is no longer infectious, confirmed by 3 negative sputum samples. Symptom resolution alone is not reliable. Question 32. A nurse is preparing a TB patient for discharge. Which teaching point is most important to emphasize? A. Stop medications if you feel better. B. Avoid using public transportation. C. You can share personal items after 2 weeks. D. Take all medications exactly as prescribed. Answer: D. Take all medications exactly as prescribed. Rationale: non-adherence to TB medications leads to resistance and treatment failure. A, B, and C contain misinformation or unnecessary restrictions. Question 33. A family member visits a TB patient in isolation. Which action by the nurse ensures safety? A. Provide surgical mask and gown to the visitor. B. Allow unrestricted access. C. Require the visitor to wear an N95 respirator. D. Let the visitor decide their comfort level. Answer: C. Require the visitor to wear an N95 respirator. Rationale: airborne precautions include N95 mask use for anyone entering the room. A surgical mask is insufficient for TB. Allowing unrestricted access is unsafe. Question 34. Which patient should the nurse see first during morning rounds? A. A TB patient reporting night sweats. B. A TB patient reporting new vision changes. C. A TB patient eating breakfast. D. A TB patient requesting a chaplain. Answer: B. A TB patient reporting new vision changes. Rationale: vision changes may indicate ethambutol toxicity, requiring immediate attention. Night sweats and spiritual support are important but not urgent. Question 35. A TB patient's medication regimen includes isoniazid, rifampin, and ethambutol. Which lab value is most important to monitor? A. Hemoglobin. B. Serum creatinine. C. Liver enzymes. D. Potassium. Answer: C. Liver enzymes. Rationale: TB drugs are hepatotoxic, particularly isoniazid and rifampin. Monitoring liver function is essential. The other values are not directly impacted. Question 36. The nurse is providing discharge education to a TB patient. Which behavior indicates understanding? A. The patient plans to stop isolation after 1 week. B. The patient agrees to follow up monthly. C. The patient decides to take half doses to reduce nausea. D. The patient plans to resume work immediately. Answer: B. The patient agrees to follow up monthly. Rationale: Continued monitoring ensures treatment effectiveness and detects complications. Other options show misunderstanding of TB management. Question 37. Which symptom requires urgent provider notification in a TB patient? A. Sore throat. B. Numbness in hands and feet. C. Dry mouth. D. Low-grade fever. Answer: B. Numbness in hands and feet. Rationale: peripheral neuropathy may result from isoniazid toxicity and must be addressed quickly. The other symptoms are less urgent. Question 38. A nurse is preparing to administer TB medications. Which patient statement requires immediate follow-up? A. I sometimes skip doses if I feel nauseated. B. I take the pills with water on an empty stomach. C. My urine looks orange, but I heard that's normal. D. I avoid alcohol while on these meds. Answer: A. I sometimes skip doses if I feel nauseated. Rationale: skipping doses contributes to resistance and treatment failure. This must be addressed immediately. B, C, and D reflect correct understanding. Question 39. What is the priority concern for a TB patient prescribed ethambutol? A. Hepatotoxicity. B. Ototoxicity. C. Nephrotoxicity. D. Optic neuritis. Answer: D. Optic neuritis. Rationale: ethambutol is associated with vision disturbances and requires regular eye exams. The other options are linked to other TB medications. Question 40. A nurse is reviewing a TB patient's chart. Which finding is most concerning? A. Clear lung sounds. B. Reports of dizziness. C. LFTs 3 times the normal range. D. Normal CBC. Answer: C. LFTs 3 times the normal range. Rationale: elevated liver function tests suggest hepatotoxicity, which can be life-threatening. Monitoring and possible treatment changes are necessary. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.